After our video breakdown discussing the mechanism of action of how metformin is used for individuals with type 2 diabetes, we were asked if we could give information on how metformin is used for individuals with PCOS, which has recently been renamed PMOS. And it's being prescribed off-label for this condition due to its ability to improve insulin resistance that also helps with menstrual cycle regulation, with fertility, as individuals who are taking metformin have shown significantly higher pregnancy rates, as well as reducing androgen levels. So let's walk through the two main pathways of how metformin is used to help individuals suffering from PCOS or PMOS. Now, 80% of these patients suffer from high levels of insulin, and many cells have actually become insulin resistant, and that leads to high amounts of glucose in the blood. So metformin can work directly by binding to a protein called MEC1 in liver cells that decreases the production of another protein called AMPK, and that turns on glucose-making genes. So by reducing the amount of AMPK, now the body isn't making as much glucose. Additionally, metformin can bind to a transporter in the gut called SGLT1, responsible for absorbing more glucose into the blood. But by blocking that transporter, less glucose is absorbed. Now, insulin and glucose levels are important because they also directly affect ovarian cells, because when there is increased amounts of glucose and insulin available, this can increase the amount of androgens present, and increased amounts of androgens can disrupt the reproductive cycle. So by decreasing the amount of glucose available and regulating one's insulin, this can directly help ovarian cells, but metformin can bind to those ovarian cells and decrease the enzymes that actually make androgens, therefore further decreasing the amount of androgens or testosterone present and helping with reproductive cycle regulation. So let us know in the comments if you or someone you know has ever taken metformin for PCOS or PMOS and their experiences with it, or if you have another medication that you've heard about that can also be used for this condition, make sure to let us know in the comments. And for many more scientific lessons, make sure you visit medtopics.com. Thank you all so much for watching, and if you're not already, make sure you're subscribed to the channel by clicking over here, and you may also enjoy this related video that I have over here. I'll see you on the next one.